Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. We're talking to Bonnie today, and we're going to talk a little bit about mid-face implants or cheek implants. And this is really one of the most underserved areas of cosmetic facial surgery. It's amazing how many really competent surgeons will do brow lifts and eyelid surgery on the upper face. They'll do nasal surgery and eyelid surgery on the middle face, on the lower lids. They'll do facelift and neck lift and whatnot on the lower face, but they'll completely forget about the mid-face. One of the things that's really important to understand is that youth equals beauty, and youth also equals fullness, volume, and curves. So if you look at young people, they have curves here. When they smile, they have curves, and they have fullness, and they have this curvature. As we age, we start to get flat here. Now, in Bonnie's situation, partially because of has some Native American heritage. She's got great lateral malar projection, but like many people her age and my age, she's starting to lose the volume in the submalar region. So a lot of times patients won't actually realize this. So if you ask a patient to smile, what that does is that really kind of brings the cheek up, and then if you hold it and ask them to relax, and you drop it, and if they relax, it drops. So smile, now relax. So if I have her cheek up here restoring that volume and I drop it, what it does is it turns into her jowl. Smile, relax. So you have to illustrate to a patient that what they used to have here is now down here, because a lot of people, they really don't understand mid-face volume. So some people like to do fat transfer. Personally, I don't. I think it's multiple procedures. I think that it's not predictable. I don't like to put permanent anything in the cheeks because this is soft tissue, and as you age, where's that fat and filler going to go? All right. The nice thing about cheek implants is they go in from the mouth, so there's no scar. A small screw holds them in place, so they're permanent. But they're completely reversible. If the patient doesn't like it or wants to change it, they're very easy to remove. So when we talk to people about cheeks, we want to underline the need for it. I do about 2 facelifts a week. It's one of my favorite procedures, and virtually 100% of my facelift patients need cheeks. Now, some people don't want them. Sometimes we'll use injectable filler, but again, that's temporary. I talked about putting permanent things in there. I think cheeks are the perfect option. So to further illustrate when somebody says, well, what would I look like with cheek implants? Well, one of the things we can do is we can put the chair back here a little bit, and this will really kind of help us. Every inch that Bonnie goes back, she's going to be rejuvenated about 2 years. So when she is down in the horizontal position and she puts her chin up in the air, and give me a mirror, please. If she looks in the mirror, she's going to have a good idea of what she would look like with cheek implants. And so a mirror is very important to have. And what happens in this situation is her jowls, because of gravity, are now reset to the cheek region. So that's an excellent way to show people what they may look like with cheek implants. Now, frequently people will say, doctors and patients, how do you know what type of implants to use? First of all, I only use silicone implants. I do not like porous implants, although they may be fine when they integrate. If you ever have to remove these, they can be an absolute nightmare and cause a lot of damage. So I use Implant Tech silicone implants, and they're basically 3 indications. Now, Bonnie has very nice malar projection, but she needs submalar fill. So this is a submalar implant, and this is made to have most of the augmentation right here. And this is probably 95% of the implants that I place are submalar. If she didn't have this cheekbone, and if she had fullness here, but she just wanted that high cheekbone look, this is a malar shell. And this is designed for more of that lateral malar augmentation or the high cheekbone look. I do this, but this is my least frequently placed implant. And I think in some cases this is a little bit dated. I think years ago people liked that really lateral cheeky region, but I think more contemporary now is submalar fill. Now if you want a combination of both of those, So some people, they've lost their submalar fat and they don't have malar projection. Then this is the combined submalar implant, and this serves to augment both of those regions. So it's generally one of these three implants that we're using. And when everybody is different, so there's artistry in cosmetic surgery. So if you ask somebody to smile and you look at the area that fills, then you ask them to relax, and you can just about see perfectly the regions that need to be filled. Smile, relax. And again, in Bonnie's case, this is more of a submalar type fill, because we would just taper out in this area, and we certainly don't need much cheekbone fill at all. So by doing cheek implants, some patients will do this as a sole procedure. We'll just do this by itself, and it's a neat little procedure. It's a little mid-facial lift. Their friends won't know what they did. I think it's kind of one of Hollywood's best kept secrets. It's really kind of a minimal recovery, generally around a week, and it's just one of those things to freshen people up. So in younger patients, we may just do cheeks by themselves. Patients beyond their fourth decade, in their late 40s, 50s, 60s, then almost 100% of people need some type of augmentation. And again, you can do fat, you can do fillers, you can do implants. And I've already explained why I think implants are the ideal treatment. There's not many things in cosmetic surgery that are permanent and are reversible. And silicone is a very biocompatible material. It's in all types of medical equipment and internal devices and pacemakers and situations like that. So this is basically how we address the midface. And unfortunately, I still see people that have been operated on some of the most famous surgeons in New York City or in Beverly Hills, and they have a nice lower face, they have a nice upper face, but somebody skipped over the midface. Remember that midface is volume, volume is youth, youth is beauty. So this is Dr. Joe Niamtu, lovethatface.com. Thank you very much.